Hello friends, welcome to Creative Medicine. In this lecture, we will learn about
Then, all of the following are true regarding follicular genesis and ovulation except in follicular genesis and ovulation, follicular development and differentiation takes about 85 days. True. Then, anti-Mullerian hormone supports monofollicular development. First phase of follicular growth is gonadotropin insensitive. Elevated and static levels of estradiol is essential for ovulation is not true. Then, which of the following is related to granulosa cells? Except. So, granulosa cells has got no blood supply. True. In the first half of the cycle, it has no steroidogenic function. This is false. They have steroidogenic function in the first half of the cycle.
Granulosa cells will actually help in production of androgens and estrogens. Granulosa cells and theca cells. So in the theca cells, there is formation of the androstenedione will occur and testosterone will occur. These, in the presence of aromatase in the granulosa cells, they get converted to estrogen. So all of this occurs in the first half of the cycle. So there is steroidogenic function is seen in the first half of the cycle.
In the first half of the cycle, these granulosa cells will produce inhibin and estrogen in the first half of the cycle. Granulosa cells produce activin and inhibin. Yes, and estrogen stimulates the proliferation of granulosa cells. So this is the false statement. Then, granulosa cells produce estrogen with the help of the enzyme. Granulosa cells produce estrogen with the help of the enzyme aromatase.
thank you and thank you for watching.